moving ahead, we're getting only about 40 minutes left, and we've got a lot of questions. So this would go to you, Jonathan. How would you vote for S-CHIP program, and what about health care? That's a twofold question.
Twofold question. S-CHIP, I would have voted in favor of it. I've been voted to override it. Override the veto that Bush so unfortunately stamped on a wonderful program. However, S-CHIP does not go far enough. I would have a much broader program. I believe that every child in America, 18 and under, should have an absolute guarantee of food and health care. So S-CHIP was one way to get to that end. There are many other programs. We have wonderful programs, the WIC program, for example. But at the end of the day, what we should really do is change the law to require that every child in America have an absolute guarantee of food and health care. And as I spoke in my opening, because I addressed many of the issues in my opening, because I stand for things, because I have real solutions to the real problems we face, not just the ones I talked about, but other ones, many other ones. But as I talked about, I believe in universal health care for every Illinois family and for every American. And I will work as hard as I can to have that happen. I don't have a specific delivery mechanism in mind. I understand the strengths and weaknesses of many of the different delivery mechanisms, but as a lawyer who has worked for many, many years negotiating and compromising, I will work with the different divisions in the Democratic Party, and there are differences about how you deliver health care in the Democratic Party. I'll work with all of the people in the Democratic Party and across the aisle with the Republican Party so that we can get universal health care. I will keep focused 100% of the time on universal health care as I speak with all the different players involved and try to negotiate a universal health care program that delivers health care to every American family.
Okay. John, could you guys please stand up so they can hear you in back to project a little bit louder?
Absolutely. My name is John Lash, for those in back, if you're just joining us. The question was S-CHIP, and I believe, would we have voted to override the President's veto of S-CHIP? I agree, yes, I would have voted to override the President's veto of S-CHIP. I attended a rally, and I was deeply shocked to not find some of our pro-life Republican friends there, like Chris Lausen, who spent all of his time trying to protest a clinic down in Aurora almost on a near daily basis. But it shows that the Republicans don't care. They'll do anything to get that baby out of the womb, but they just don't give a damn once that child is into the world. And I think that this is an issue that unites people. I also agree that S-CHIP does not go far enough. We need to have a single-payer national health care program, a health care system that seeks to take care of people that are sick instead of a health care system that seeks to make people profits. That is what is behind single-payer national health care, H.R. 676. The bill exists. A vote for John Lash is one more vote to pass that bill and get it on the floor of the House of Representatives and force the Republicans to take an anti-life position on health care. Furthermore, I want to just say that I have met numerous people that don't have health insurance. This touches people from all economic backgrounds. You never know when the health care crisis is going to hit your family. And this is a good insurance policy because it covers everybody. Everybody in, nobody out. That's the kind of health care system we need in America.
Sure. Stand up and project a little louder. We're having a hard time here.
Okay. All right. So just to get it out of the way, yes, S-CHIP override, of course. I think we're in violent agreement, all three of us. Fine. I am also in favor, as I guess all of us are, of universal health care. I am agnostic as to whether this thing has to be 100% single-payer federal program or can have some commercial involvement. I, as a scientist, will look at which system provides the cheapest delivery of medical care. Current estimates are that something like 30% of our healthcare dollars are gobbled up by insurance companies. And in bureaucratic overhead, the truth of the matter is, all of you know, is that insurance companies make money by denying benefits and excluding people from their roles if they have health problems. This is the nature of the beast. On the other hand, if you have a single-payer health care system, there are non-zero bureaucratic overheads. And the current estimates that I have seen that come from other countries are that about 10 to 15% of your healthcare dollars are gobbled up in single-payer healthcare with bureaucratic overheads. Now, if that number plays out when the system is prototyped in the states of the United States, and you really see that number is true, then the answer is obvious, that you go with a system that gobbles up the least of your healthcare dollar, be it single payer or be it something that involves some combination of private enterprise and. So I guess that's a difference. I have a huge difference with our opponents on the Republican side, whose idea to make healthcare cheaper is to obliterate the incentives for employers to provide any healthcare at all, and replace it with nothing. I guess I'm pretty far from that one.
My name is John Lash. I approve this message.